A 36-year-old male presented with complaints of palpitations for the past few hours. The ECG was taken during the episode. Now let's decipher this ECG. First of all, on a gross look, we can identify that this is a tachycardia that is going on. So the ventricular rate for this patient was above 100 beats per minute. Now we can see that the ventricles are firing very fast, but there is another thing that is going on, and that is it is an irregular rhythm. We can clearly see the QRS complexes. There is a difference between the rate of the firing of these ventricles. Now this is an irregular fast rhythm. The differentials for these can be many. Now we have to identify the other features to reach to the diagnosis. Now the most important point in this ECG is where are the P waves, because we can identify that the QRS appears to be narrow. We can see it over here, and the rhythm is irregular. But what about the P waves? So is it some atrial rhythm that is firing fast, or it is something else? Now let's move forward. Here we can see that there is some wandering of the baselines, and because of these wandering there is a confusion regarding the complexes. We cannot see a clear cut P waves. The arrows points towards something. These wandering baselines look very regular. If you can see it, there are humps over here, 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 and here. So they are kind of firing regularly. Now we can also identify the QRS complexes in between them. These are over here, here, and here. Now where are the P waves? So is it something that is related to the atria, but there are no P waves present? So what can these be? The shape of these complexes appear to be sawtooth, as we can see it over here. So we can clearly see these humps over here, here, and here, and these are a sawtooth pattern. And we can see that this pattern is very familiar to this one. So this is basically based on the pattern of an atrial arrhythmia, in which we can see these waves, and these waves are called sawtooth complexes or sawtooth waves. Now this is very important finding that should always lead to some diagnosis. The rate for these sawtooth complexes, which are basically the firing of the atria, is around 300 beats per minute, which is pretty fast. And this is very important to understand the rate as well, because there is a tachycardia which has such a faster and a regular rate with this sawtooth pattern. This is called atrial flutter because this is a regular rhythm. It is arising from the atria, and the rate is 300 beats per minute. So it is called atrial flutter. So in summary, the atrial flutter is an atrial arrhythmia with the atrial rate ranging between 250 beats per minute to 350 beats per minute. The ventricular rate can be regular or irregular. The pathognomonic sign for this tachyarrhythmia is presence of a sawtooth or flutter waves. These waves are best seen in the inferior leads and the lead V1. Now, one most important point is the absence of isoelectric line for this arrhythmia, because if there is an isoelectric line present, then this is most likely an atrial tachycardia and not flutter. So for a flutter, the isoelectric line should not be there.